Good afternoon. We will now commence fourth special webinar on COVID-19 for policy and technology sharing, focusing on immigration and quarantine. I am Commissioner Kyu Cha of Korea Immigration Service at the Ministry of Justice. I'm very pleased to communicate with officials and experts around the world through this webinar. Currently, Republic of Korea receive inquiries and requests from international community to share Korean quarantine experiences, also called K-quarantine, as a way to systematically respond. 12 government ministries and 6 related government agencies have formed a comprehensive international cooperation coronavirus task force. Led by International Cooperation Coronavirus Task Force, webinars are organized in a series by topic. The fourth special webinar is prepared by the Ministry of Justice with cooperation from KCDC, the Ministry of Foreign Affairs, and KOICA, Korea International Cooperation Agency. Before we officially kick off the presentation, Minister Mi Chu of Justice will deliver welcoming remarks. Minister, please. Good afternoon. I am Minister Mi Chu of Justice of Republic of Korea. I'm very pleased to meet officials and experts working on immigration and quarantine through this webinar. Governments around the world are doing their best to protect the health and safety of their people to respond to an unprecedented infectious disease called COVID-19. All the immigrations and quarantine officials attending the webinar today are making dedicated services and sacrifices to prevent the disease at the forefront. I'd like to take this opportunity to express my sincere gratitude for your hard work. Many countries around the world have taken extraordinary measures to prevent the influx and spread of COVID-19, such as border closure, entry ban, and flight suspensions. However, based on principle of openness and transparency, the Korean government has implemented various measures to control inbound, identify movement of inbound while minimizing interference with border movement. Korea's composed and step-by-step response have been introduced as best practices around the world. The basic task of Ministry of Justice is establishing the legal order. However, we are also responsible for the border movement. As people move around, viruses also travel and can be spread all over the world, so the role of Ministry of Justice policy is critical in blocking the spread of infectious disease. The goal of today's webinar is to share Korea's experiences to block influx and spread of COVID-19, especially in immigration and quarantine. We hope that Korea's policies and experiences in dealing with COVID-19 can be helpful and also give some insight to countries around the world. We look forward to learning the technologies and experiences of other countries as well. Thank you very much for joining us at the webinar. If the world is not safe from infectious disease, safety of a country cannot be guaranteed. I wish all of us can overcome COVID-19 through an open and transparent efforts. Thank you.
Thank you for your opening remark. And now, before we begin the seminar, I'd like to give you some housekeeping announcement. Simultaneous interpretation service is provided in English, French, and Spanish so that as many participants as possible can join us. For the regions or areas where real-time attendance is difficult due to time difference, we will rebroadcast the webinar again at 11 o'clock tonight. After that, we will post a webinar video clip on the bulletin board of the task force team so that you can watch it anytime. For the next 1 hour, there will be a presentations on 4 topics, followed by 30 to 40-minute long Q&A session. If you have any questions along the way, please post your question in the question box at the corner on the right side of your screen. Now, let me introduce today's presentation topics. First, there will be a presentation on tightened border control policies to block COVID-19. Second, incoming foreigners' visa and residence policies to prevent spread of COVID-19. Third, immigration clearance supporting the quarantine and infectious disease prevention at the Incheon International Airport site will be covered. Last but not the least, the quarantine and entry control measures for inbound travelers will be covered. Now, the first presenter, Director Bonjun-gu, Border Control Division, Korean Immigration Service, Ministry of Justice. Would you please begin your presentation?
Hello, everyone. My name is Bonjun-gu, and I'm the Director of the Border Control Division at the Ministry of Justice, Korea. I'm very pleased to have this opportunity to introduce Korea's policies regarding COVID-19 to other countries around the world. As you may have already noticed, I'm not an English native speaker, but I can speak Korean very well. So from now on, I'll start my presentation in Korean language. 안녕하세요.
Hello everyone. I am Director Bonjun-gu, Border Control Division, Korea Immigration Service, Ministry of Justice. Welcome to the webinar, and I'm very pleased to meet people from around the world. It is my great pleasure and privilege to introduce measures taken by Republic of Korea in response to COVID-19. The title of my presentation is Tightened Border Control Policies to Block COVID-19. Throughout my presentation, I'll be covering first, inbound control, second, outbound control, third, future plans responding infectious disease. Let me explain the initial response measures taken by Korea Immigration Service Ministry of Justice. On January 20, a female passenger came from Wuhan province, China, was identified as the first case of COVID-19, which started a full-scale pan-government response. First, the government of Republic of Korea has raised the infectious disease level from attention to caution, which is yellow. According to the Ministry of Justice National Infectious Crisis Manual, the Korean Immigration Service set up Immigration Situation Room at KIS headquarters and COVID-19 response system targeting airports and ports across the country and foreigners staying in Korea. The Ministry of Justice visited Incheon International Airport on January 22nd, right after the first confirmed cases occurred, to supervise immigration and border countermeasures against the COVID-19. We took active response. First of all, I will explain the inbound control measures that we have taken to block COVID-19. The pictures on the screen is the image of our immigration officer conducting quote-unquote special entry procedure at the Incheon International Airport. The Korea Immigration Service has implemented inbound control measures in 3 areas. First, phased visa control by Korean diplomatic missions abroad. Second, selective boarding control by airport on departure. First and second, I will explain, and third topic, immigration clearance by airport on arrival, will be presented by Director Lee of Border Control Bureau of Incheon International Airport. First, phased visa control policy. Although there are differences between countries and stages of COVID-19 spread, the border control measures were required to minimize the influx of infection while to ensure movement of essential personnel across border. The KIS took steps for phased border control to curb tourism and simple visit that cannot be seen as necessary or essential. The effect of the existing valid visa and visa exemption agreement and visa-free schemes were suspended in phased manner. In addition, in order to prevent the entry of infection suspected of people with COVID symptoms, all visa applicants were obliged to submit a health questionnaires, and Korean overseas diplomatic missions have been issuing single-entry visa after more than 14 days of thorough review. However, to guarantee the movement of essential personnel involved in international trade, business, and healthcare, visa issuance was permitted promptly even before 14 days. As a result, approximately 2.36 million short-term visas have been suspended so far. The visa issuance rate has decreased by 80.8% and foreign entrants decreased by 81.1% compared to the previous year. Instead of recklessly closing and shutting down the border, Korea was able to maintain sophisticated and scientific open border policy that maintained the basis of openness. Second, the selective border control. To maintain an open border policy, the Korean government needed effective measures to preemptively screen out infectious passengers and prevent them from boarding the aircraft to Korea. To this end, the eye pre-checking system was actively utilized. Eye pre-checking system, known as IAPI system, links the airline's reservations and ticketing system with the KIS border control system at the check-in stage of the departure airport, blocking the check-in of a passenger from entering Korea at the departure airport, thereby blocking the high-risk passengers coming into Korea. Through the IPC system, inadmissible passengers who have traveled from the virus hotspots or holding suspended visas were denied boarding plane to Korea. Total number of the passengers was quite high, and the selective boarding control enabled Korea to secure effectiveness of the phased visa control policy and maintain an open border policy instead of full-scale border closure. Let's look at the impact of inbound border control. On February 4th, the first entry restrictions measures were implemented by KIS centering on Hubei province, China, where COVID-19 first occurred and the number of confirmed cases soaring. As a result, the number of international arrivals that exceeded 40,000 per day has gradually declined. As we enter March, the number of domestic COVID-19 confirmed cases marked with blue line significantly increased. Displayed in gray bar graph is the number of international confirmed cases entered Korea, which hit record high. Accordingly, we have expanded the existing measures to strengthen inbound border control. Since then, cases of international confirmed cases entering Korea have decreased, and the increasing trend in domestic confirmed cases has declined. As we enter April, the growth rate of domestic COVID-19 confirmed cases has been flattened and maintained. As coronavirus spreading across the world rapidly, we took the third measures. Visa restrictions and travel restrictions of passengers were extended to 56 visa waiver countries and 34 visa-free countries. As a result, the current trend of coronavirus spread is somewhat stabilized, and we believe that phased and selective border control policies have contributed in maintaining this trend. I'd like to explain some of the issues and concerns the KIS experienced as we stepped up the foreign entry management measures. The first is the different views regarding policy directions on border control. People demanded the government to ban entry of foreigners from the early stage of COVID-19 to block influx of infectious disease from abroad. According to a poll conducted at the end of February, 55.6% of the respondents said that they believe the government should reimpose total entry ban on arrival at border. However, the Korean government faced a number of complex issues such as economic exchange, diplomatic relations, and humanitarian situation comprehensively, so it was very difficult to determine the policy direction that could solve these complex issues. The second issue is the protection of Korean nationals living abroad and their foreign families and what kind of protections we have taken. One of the important tasks of the Korean government was to protect Korean nationals. As you can see in this photo, a chartered flight was sent to countries and regions where borders closed and lockdown was enforced due to COVID-19 to actively support the return of the Korean nationals and their foreign families. Next photo is a screenshot of a thank you interview given by an Iranian wife whose husband is Korean national, so they flew to Korea in a chartered flight on March 19, 2020. However, the biggest hurdle in protecting Korean nationals was complete border closure that didn't even allow entry of their own nationals. As a result, there were many people who wish to return to their home countries but are tied up and many are suffering under the current situation. It is my view that people should be allowed to return to their homeland on humanitarian grounds. Second, let me explain the outbound control measures. The picture shows the passenger fever checking being carried out at the departure hall of Incheon International Airport. In response to COVID-19, there are two major ways to step up outbound control. The first is prohibitions of departure to support quarantine authorities, self-isolation, and second is cooperation with airlines through notification of high-risk passengers. First, let me touch upon the prohibitions of departure to support quarantine authorities' self-isolation. As the number of COVID-19 confirmed cases surged in Korea, it was necessary to block the COVID-19 from spreading abroad and strengthen the self-quarantine scheme. At the request of Korea Center for Disease Control and Prevention (KCDC), the Ministry of Justice (KIC) received a list of persons subject to self-quarantine and imposed departure bans according to Immigration Act. Total of 22,607 were prohibited from their departure during their 14 days self-quarantine period. Through this, prohibitions of departure were actually happened and it prevented outbound spread and strengthen the self-quarantine scheme. The second topic is notification of high-risk passenger. Increased risk of COVID-19 put airlines at risk, such as infections between passengers, reductions or suspensions of aviation routes. The Ministry of Justice utilized pre-checking system to support the airlines at the time of crisis. The airlines were notified when high-risk passengers who travel from or transit COVID-19 hotspots within 14 days so that the airline can strengthen quarantine cooperation with the destination countries in advance. A total of 24 passengers boarding were notified since March 11th, out of which 18 were denied boarding after discussion between airlines and authorities authorities of the destination country. This enables strengthening of quarantine cooperation between the country of origin and the destination and ensure the cross-border movement of essential personnel. Lastly, let me touch upon the future plans in response to infectious disease. This picture shows the status of arriving and departing passengers through the eye pre-checking system. The Ministry of Justice's future plans to respond to COVID-19 is as follows. First, arrival card management will be reinforced to confirm the residency of foreign guests. As a way to manage foreign staying in Korea, the Immigration Act was revised to fine foreign arrivals or to impose penalty if they submit false arrival card. When the national crisis alert is issued, foreign guest information must be provided to the government, Minister of Justice by accommodation provider under the newly established provisions of the Immigration Act. In 2021, the Electronic Travel Authorization or ETA system will be introduced. Recently, ETA has been introduced and operated for visa-free foreigners entering Australia, the US, Canada, and New Zealand. Korea also revised the Immigration Act to introduce the ETA in February this year and is currently pursuing a system so that ETA can take effect next year. ETA is non-face-to-face online system that collects and analyzes information necessary for border control and quarantine in advance to block high-risk people from entering into Korea, while ETA system can be used as a new communication channel between foreigners wishing to come to Korea and Border Control Authority. Lastly, we will gradually expand the border control area. For effective response to infectious disease like COVID-19, the border control area should be expanded to the point of departure or originating countries. We felt the need to do so. Korea's eye pre-checking system is an interactive system that broadens the border control area to the point of departure and is used currently by 20 countries around the world. The Ministry of Justice will continue to expand to strengthen and build a safer border management system. Thank you.
Thank you, Director. In a pandemic situation, it is inevitable to curb the movement of the people between countries in order to suppress the spread of the infectious disease. He explained the measures taken by ROK, such as a suspension of visa validity, control of visa-free entry, and reinforcement of visa issuance requirements. Korea implemented the 3 stages of border control based on evidence while allowing movement of key personnel. So thank you for covering it quite thoroughly. And he also explained the utilization of an eye pre-checking system to ensure effective step-by-step border control. And he also spoke about challenges Korea faced. He also talked about how KIS operated departure prohibition and airline notification system to ban high-risk travelers from boarding, thus blocking spread of COVID-19. He also mentioned KIS future plans regarding strengthening the disembarkation code and accommodation notification and ETA electronic travel permit system. Now, Deputy Director Kim Myung-hoon, Visa Residence Division, will make a presentation on visa and residence policies. Floor is yours. Thank you. Good afternoon. I'm with the Korean Ministry of Justice Immigration Service Agency, and my name is Kim Myung-hoon, in charge of managing visa-related policies. Today, I'm going to talk about Korea's visa policies in response to the COVID-19 crisis. Let me express my special thanks to the Ministry of Foreign Affairs and COICA for hosting this event today. And I'd like to thank all the audience as well. Let me begin my presentation without further ado. First, these are the contents of my presentation. First, I'm going to talk about the statistics. As you see here, these are the statistics of the foreigners staying in Korea. They are divided into short-term and long-term. As for the short-term stayers, they come to Korea for tourism or businesses. And as for the long-term stayers, they come to Korea to do business, or they have the job here in Korea, or they study in Korea, or married to Koreans. As of 2019, the long-term stayers are 1.7 million, and short-term stands at around 790,000. Due to the COVID-19, the number of short-term stayers declined dramatically, whereas long-term counterparts stay about the same. The composition of this tells us that they are different. And actually, they are quite different in terms of the nature. In general, those foreign residents who live in for long have quite active interaction. As I said, the long-term stayers are different from the short-term stayers. The long-term stayers have a very active interaction with the local people. At workplace or at school, they interact or intermingle with Koreans quite significantly. Meanwhile, the short-term stayers do not have that much interaction with the local people. This means that we have to take different measures or approach to these two groups. And as for the short-term stayers, we may find it difficult to trace them because they come to Korea to move around, to see and enjoy, because they come to Korea to travel and sightseeing. So we have to keep in mind that it's hard to track those people who come to Korea and who stay short period. And as for the long-term stayers, they are supposed to report their residence address to the authorities, which means that we can track them without difficulties. So these are the features of the two groups I want to emphasize. Based on such data, what we have done, this is the topic that I'm going to cover now. Restriction of entry was touched upon by Director Gu already before me, and then on-site response will be covered by Director Lee from the Incheon International Airport authorities. So I'm going to mainly talk about policies. Visa is essentially a restrictive measure to control entry at the border. So we determine who are allowed to enter and who are not. Every country uses visa as a tool to determine who are allowed or denied entry. So the visa policy is basically a measure to restrict inflow. And we have come up with a health check form, as you see here, in collaboration with the authorities in charge of disease prevention. So applicants are required to fill out information on the symptoms related to COVID-19. And there is a section to validate whether the information filled out here is correct or not. And when the diplomatic missions, Korean diplomatic missions abroad issue the visa, they check whether the information provided here is correct or not. In order to do that, they conduct interviews over the phone. And they do it not once, but several times, so that they can check whether the person has the symptoms like cough. And in addition to that,
적용하지 않은 목적으로 이제 한국에
we
입국하는
also
경우
use the
그런
visa
목적으로 비자를 신청하는 경우를 이제 제한하는
to restrict those people who come to Korea or want to come to Korea for the purposes which are not urgent.
원천적으로 봉쇄하고 있거나
Actually, we haven't
기본적으로
closed the
지금 현재
border,
전 세계적인 코로나19 확산
but
동향,
due
그리고
to
한국에서의
the
코로나19
situation
동향,
abroad,
저희
the
방역적
pandemic
필요성,
of
관리 필요성을
COVID-19,
볼 때
we are
실력이 어려운
obliged to
관광 목적으로
restrict
입국하시는
the
외국인들은
entry of those people who are hard for us to trace and track.
방문을 자제.
So as for those people who want to come to Korea for tourism or for the purposes which are not urgent, we ask them not to come in.
상용 목적으로 이제 방문하시는 분들에 대한 어떤 비자 면제 조치를
And then the waiving of the visa application has been suspended from April 13, which means that
여기 나와 있는 것처럼 이제 헬스 컨디션을
those people for which the visa was waived now have to apply for the visa.
이제 이 어떤 그 실질적인 어떤 유입
However, as I said, we haven't closed the border and stick to the principle of the openness, which means that we allow those people who have urgent need to come to Korea. So I'm going to touch upon that later on. And as for the visa can be used as a means not only to control but also to provide support. In order to provide support to the right person, we need to have access to the information of those people. Visa data are the right source of such information, especially those people who are staying on a long-term basis in Korea. So one of the representative examples is what we did in collaboration with the Korean Center for Disease Control and Ministry of Food and Drug Safety, which is the provision of the masks. I'm going to touch upon this topic later on. For the epidemiological purposes, we have provided various information. As of now, hundreds of thousands of cases of data were provided to the local government so that they can identify those foreigners at risk and get the test done, which is free of charge. So let me dive into the details. For those people or foreigners staying in Korea, they find it difficult to get access to the information. It must be the same for anybody living in another country because we have language barriers. COVID-19 is highly contagious. Even those without any symptoms can infect others without knowing it. So we should be able to at least identify those with symptoms as soon as possible. This means that we should enable those with early symptoms to report right away so that we can make acute response. With this end in mind, we installed the window of communication, which is 1345 call center exclusively for foreigners. So it says 1345 call center, which is open to all foreigners and they can receive consulting services, and 20 languages are supported. So whenever they find themselves have symptoms, they will find easy to report it to the authorities. So working with the Korean Center for Disease Control, we made it easy for foreigners to report the symptoms that they have. And also, this is a window through which they can have access to the information on their health, including COVID-19. As you know, since the COVID-19 crisis occurred,
감염된 상태에서 의료기관에
It has
방문하는
become
경우에
difficult for us to get access to hospital. Once you are infected, actually they should refrain from coming to hospitals. So we set up the testing booth and sites across the country. Such information on the testing booth and sites has been given to foreigners living in Korea. As I said, that information is communicated in 20 languages. So the statistics demonstrate that this has been quite effective. By mid-May, as you see here, the total number of calls responded was more than 75,000 cases. And of those, 400 cases led to the disease control activities. This shows that in terms of the information provision and disease reporting, this kind of multi-language support system is quite effective and beneficial.
이어서 이제 말씀드릴 수 있는
Now,
이 코로나19 대응을
I'd like to talk about masks. As mentioned briefly already, the Ministry of Justice distributed masks to the general public through civil organizations. In addition, quality masks with the KF certificate have been supplied to the foreigners living in Korea on long term. Foreigners staying or living in Korea found it difficult to purchase masks in the early days of the corona crisis because of language barrier and then the price, which kept on rising. In order to correct this, the Korean government tried to find ways to make sure that masks are distributed evenly and the foreigners have access to that too. This means that we have to prevent one person from purchasing too many masks at once. In order to do this, we have to have information on people, including foreigners. Why? Let's say that one person buys 100 or 200 masks at once. This should not happen. Ministry of Justice have information on foreigners staying in Korea, so we make sure that each person can purchase a certain number of masks, not too much. So in order to have the system in place, since the Ministry of Justice have the information on foreigners, as I said, that information on foreigners has been sent to the healthcare authorities, which in turn sent that information to the drugstores across the country. So it says 1.6 million people or 1.6 million foreigners living in Korea. In order to support them to have a good access to mask purchase, we have implemented a mechanism that enables them to purchase masks without difficulty. So each week, about 400,000 foreign residents are purchasing masks. First, masks are proven to be effective for disease prevention in a series of studies. I believe that our system allowed people to have fair access to masks. By doing so, we helped block the spread of the disease. Last but not the least, I'm going to talk about the lessons that we have learned or insight that we got from our experience. As for our response, it was not perfect. We had to come up with and make many things from scratch. First and foremost, we had to make decisions on who are allowed to enter and who are not. As I said, those people who want to come to Korea for tourism purposes or other purposes which are not essential, they are recommended not to come in. So such message has been spread.
어떻게 좀 효과적으로 좀 입국 루트를 만들어줄 수 있을지.
And as for those people who have to enter,
입국을 허용한다는 건
what should
어쨌든
be
한국에 이제
done?
들어와 있는
What should be the right approach? That was the main topic or theme that we have pondered.
대상이 늘어난다는 걸
Once we allow foreigners to come in, this means that there will be more people for us to control for the
고민을 하고
disease prevention purposes.
하지만 저희의 정책 방향은 일관되게
But we cannot block the entrance or border altogether.
원칙과 조화를
We try to find the balance between the two, keeping the country safe, but at the same time maintaining the principle of the openness. So as for those foreigners who are employed in Korea or want to make investment in Korea or study in Korea, they need to be allowed to enter.
적인 어떤 대응을 통해서 유입을 할 수 있도록
So we implemented a flexible visa system
국가에서도
to allow those people with the inevitable purposes to come in. So I think that this is a part of the insight that we can share. And I also believe that our response would help Korea get out of this crisis quicker.
나아가서 저희가 이 계속
And
이 어떤 그 코로나
our response to COVID-19 or our fight against COVID-19 is expected to continue on a long-term basis. So sustainability is of great significance.
지속적인
I mean sustainable response,
전체적인
sustainable data provision,
지속적으로
or sustainable provision of
많은 어떤
information.
자원을 갖다가
For this, we have to invest
해야
a
된다라는
lot of resources,
계속해서 있습니다.
which is not easy
사실은 쉬운 것은 아닙니다. 왜냐하면
because
계속해서
we have
저 어떤 한정된
limited
예산은 한정돼 있고
budget
인력도 한정돼 있는 상황에서
and limited
계속해서
human
이런
resources.
고강도의 대응을 유지한다는 게 이제 쉽지
So we have to find the best approach of making most out of the limited resources.
나갈 것입니다. 고민을 해나가야 되는 그런 상황이라고 할 수 있을 것입니다. 그래서
So that's the situation we are in. So as for the audience
이런 부분에
who
있어서
are here with us today, please share your experience
앞으로
of response of your country
저희 대한민국
so that
정부의 향후
we
대응
can learn from you too.
될수 있을 것 같습니다. 그래서 이제 좀 저희 쪽에서 이제 저희 쪽의 어떤 그 교훈을 바탕으로 이제
So
말씀드리는
let me
저좀
cover the lessons or insight
권고라고 말씀드릴 수
rather than
홍보가
recommendations.
될 수 있을 만한
So for your reference, I'm going to talk about
이 외국인에
some of the
대해서
points that I want to share. For the foreigners, we have to make sure that we have to have a good window of communications
아까
for
설명드렸던
foreigners.
그 외국인
As I said,
그 콜센터에서 계속해서
it's a good idea to run a call center
24시간 계속해서
for
정보를
foreigners,
제공을 함으로써
which is run 24 hours a day
접근할 수 있도록
as of today.
추가적으로
around the clock.
온라인
And in addition, online bulletin board is used
직접적으로 이렇게 좀
to provide the consulting services
빨리 그런
so that
알릴 수 있도록
they can also have a better access to the information
이상으로 제 발표
on the COVID-19. This is the end of my presentation. And if you have any questions, do not hesitate to ask them. And if you need any further information, please let me know. Thank you.
네, 김 사무관 수고하셨습니다.
Deputy Director, thank you very much. Visa policy is essentially a policy that restricts the influx of foreigners while restricting unnecessary travel, while visa information can be utilized to support foreigners staying in Korea. By sharing visa information with a health authority, we supported foreigners staying in Korea to purchase facial masks at the same way as Koreans do at pharmacies. Mr. Kim introduced that KIS provides multilingual counseling, third-party interpretation with the Korea Centers for Disease Controls and Preventions in increasing foreigners' access to medical and quarantine information and support. Also, he introduced the operation of 1345 call center. In addition, Mr. Kim explained the need to provide right information and guidance to foreigners through a visa policy while considering challenges and solutions ways to secure sustainability, openness, transparency in our response to long-term wars against COVID-19. Next, Director Lee Gi-hong will present immigration clearance supporting the quarantine and infectious disease prevention. Hello everyone, I am Director Lee Gi-hong, Border Control Bureau, Incheon International Airport Immigration, KIS. My presentation will cover immigration clearance of the airport. I am very pleased to share our experience. The whole world is suffering great difficulties, but based on the fact that if we share, I'm sure that we can surmount the challenges. Let me begin my presentation. I'll be covering the response that we have taken at Incheon International Airport. There are two things that we have taken. First, how we have conducted immigration procedures at Incheon International Airport. Second, what kind of close cooperations we had with the National Quarantine Station. First, let me tell you the location of Incheon International Airport. China is located here, at the center, Korea is here, and on our right side is Japan. About 91,000 visitors come to Korea, and a massive number of inbound travelers can come to Korea. In the initial stage, the neighboring countries suffered greatly, and also we have suffered the spike of COVID-19. If you look at Korea, on the northern part, there's North Korea. In the southern part, you can see Republic of Korea, and surrounded by ocean in three sides. And it's not easy to come to Korea by sea. So as long as we manage our border well at the airport, we can definitely surmount the challenge. So the way we have taken is as follows. We did not close down the border, but rather we have strengthened the special entry procedures. The special entry procedures were implemented step by step depending on the extent of COVID-19. June 4th, beginning, we applied this to China, and then Italy, Iran, Europe, and the US, and the whole world. From April 19th, the whole world were target of the special entry procedures. Now let me elaborate special entry procedures, which can be categorized in two ways. First, symptomatic travelers. Second, asymptomatic traveler, which means that they don't have any symptoms. Let me touch upon the travelers with the symptoms. Symptomatic travelers are high risk, especially the severe symptomatic travelers. In that case, they have high risk of spreading the virus, so they are not allowed to access to the immigration booth. Rather, they are transferred to a hospital right away, and without a face-to-face immigration, a proxy immigration process will start. Total number of around 2,200 people entered the country through proxy immigration. Second, asymptomatic people who don't have any symptoms are tested for COVID-19, who have a mild fever or who shows a slight symptoms, then we conduct tests for COVID-19 at the airport, and they also are categorized as risk. So we have set out a designated, a customized immigration booth. As you can see in this photo, this is the designated customized immigration booth. You can see that people are wearing a protective equipment, and they are wearing masks and gloves as well. Here you can see that a 2-meter height partitions are established so that nothing can come, especially the droplet infection is prohibited. We have set out a special area so only the people with the symptoms are coming here to the designated customized immigration booth. Foreigners must scan their fingerprints and have their face photographed upon their arrival, but fingerprint scan means that there will be a contact. So fingerprint scan is exempted and only facial photos are taken. So no fingerprints. We have omitted that process. So this is once again the operations of the customized immigration. Around 12,000 cases were actually passed through this immigration booth. Second, people without any symptoms, no fever, no symptoms, nothing. These people go through the immigration process as usual, but we have additional safety measures. As you can see here in this photo at the back, there's an immigration booth that travelers usually pass through. We have a special desk here, and people sitting here wearing a black clothes are military personnel. They are dispatched from the military camp. When inbound travelers arrive, then the dispatched military personnel make phone calls confirming the contact numbers. And there's a phone in front of the military personnel, and when the inbound travelers submit their contact information, the dispatched military personnel make phone call right away confirming the contact number, whether it is valid number or not. And any aliens, when they arrive, they must submit their addresses and contact information. And here you can see that it's a special place where they are supposed to download the applications. And people who download the application can only pass through. So once again, these military personnel verify contact information. Immigration officers put the personal information and confirm whether self-isolation safety protection mobile app has been downloaded. And when everything's are done, then they come to the immigrations. Once again, local quarantine and health authority can check the contact number and address for quarantine purpose if deemed necessary, because the network is connected to local quarantine and health authorities. In case when it is necessary, once again, they can make contact. So, for example, when there's an inbound travelers on a real-time basis, through this network, all the informations are being exchanged. In early stage, we didn't have such a network. Therefore, manually, we have to input all the information at Excel file, and Excel files were sent by email to local quarantine. But now we have the network, so in a real-time basis, all the information are being exchanged. In early stage, we only operated this targeting the inbound travelers coming from China, but now we apply this to Italy, Iran, and to all countries around the world. As the special entry procedures had been extended to all travelers, we stopped providing automated immigration service, and the automated immigration service that we provided in the past is no longer valid. In case of Korean nationals above the age of 17, they can use automated immigration service, and more than 50% of the Korean nationals utilize this service. But in early stage of this special entry procedure, only foreigners were restricted to use automated immigration service, as our quarantine was focused on inbound foreigners. But now we are identifying addresses and residency for self-isolation, so we stopped totally the automated immigration service. Hand sanitizers are placed for use in every immigration booth. When deemed necessary, when inbound travelers need to go to another room for a thorough re-examination room, sometimes it takes more than an hour. They have to wait, which increases the risk of infection. So instead of putting them in one room, we placed a special place, and keeping the social distance, we allowed the inbound passenger one by one entering into the re-examination room, and they are obliged to wear mask. If they don't wear mask will be provided to them. Third, information boards are set up at the immigration booth informing foreigners who do not comply with the quarantine measures may be deported. Their visas will be cancelled. So these warning messages are written on the information boards. We have established the information boards everywhere so that people can easily see. Next, I'd like to touch upon the close cooperation between Incheon International Airport and Quarantine Office, Korea Centers for Disease and Prevention. The divisions of the work area has disappeared between KCDC and Incheon International Airport. In the past, we had our job description, which was distinctively different, but not anymore. In response to COVID-19, we are working very closely, and there's no boundary in our jobs and responsibility. It seems like we are under one umbrella working closely together. As you can see here, we issue quarantine notice. So quarantine notice are distributed to the inbound travelers. Originally, the quarantine notice was issued by KCDC, but now Incheon International Airport are now issuing the notice. If you look at the quarantine notice, there are two different types. First, undergoing quarantine at home for 14 days is referred as self-isolation. And second, quarantine will be carried out for 14 days at the government-designated facilities. So we distribute people who should go where. And here you can see the detailed contents of the quarantine notice, and also we have written down the penalties or the warning that we'll be issuing in case they violate. Even the criminal penalty will be imposed and punishment will be provided, and also the compensations will be imposed, and people who violate the self-isolation, they are eligible or targeted for the penalty, criminal charges, compensation, and they will be forced to depart Korea. And their visas will definitely be cancelled. And second, as you can see here, the immigration officers categorize incoming arrivals and give different passes. Red passes are given to foreigners, and who are wearing this red pass around their necks means that they will go to government-designated facilities. Yellow means they're exempted from the self-isolations. And in case of the foreigners going to the government-designated facilities are usually people with a short-term visa. In case of Korean nationals, they are all subject to the mandatory self-isolation at home for 14 days, so we don't give any pass to them. And the staff will guide them to a designated government facility. Among the foreigners with a short-term visa, if their spouses or if they have relatives in Korea, then we don't put them at the government-designated facilities, but rather they're subject to self-isolation at their homes. In case of yellow pass wearing around their necks, they are exempted from the self-isolation. They are usually diplomats or people, businessmen, or people who need to go to the funerals, or there's a humanitarian reasons, or for an urgent business purposes. In that case, Korean diplomatic missions abroad issues a special exemptions. And all travelers entering Korea with the isolation exemption certificate issued by the Embassy of the Republic of Korea are exempt from quarantine, and our immigration officers will categorize who belong to which category. Third, we have established a hotline. We didn't have any manual for COVID-19, and if there are things for certain decisions need to be taken, then we need to take actions, or a consultation must happen immediately, especially during the weekend or during the nighttime when there's a need for consultation. Then we need to exchange our views. That is why we have set up a hotline for the emergency to exchange views. Because if we do the business as usual, it will take a lot of time. Therefore, what we do is usually the people at the working level, they make decisions, and if the things cannot be determined, the middle managers determine. If things cannot be determined, then the upper people or the high-ranking government officials will determine. But that's the business as usual, which requires a lot of time and which prohibit us from making a quick and prompt decision. In order to respond quickly to the COVID-19, usually an important decision is determined by high-ranking officials and then distribute to the low-ranking officials. So this is what we do, and new manuals were set out. If deemed necessary, working level peoples and also the high-ranking officials sit together. We had a group meetings and make a decision immediately. At the airport, we have officials from the police, from the Ministry of Health, and all the government agencies so that we can discuss and make an urgent decision. Fourth, let me tell you about the call center that we operate 24 hours. When immigration officer input the contact information and phone numbers of the inbound travelers, then the local quarantine or local government can check and verify. If there is mismatching information, they make phone call, and we need to respond to that 24-hour basis, 24-hour and also 7 days a week. So such prompt response can be done by collaboration among the government ministries and quarantine offices so that we can surmount the COVID-19 challenge. This is the special entry procedures taken by Incheon Airport. Once again, let me repeat, we have implemented special entry procedure, not a total border closure. And by doing that, we were able to respond to the COVID-19. Second, there was a very close collaboration without distinguishing our roles and responsibility based on close collaboration. We work with KCDC and Quarantine Office. Countries around the world are having a great difficulties, especially airports around the world. They are witnessing decreasing number of the inbound and outbound travelers. More than 90,000 travelers used our international airport, but now 2,000 to 3,000 people are actually using Incheon International Airport right now. Now it's a high time to share information and wisely overcome the challenge so that I'm sure that we can welcome the new world again. That concludes my presentation. Thank you.
네, 국장님 수고하셨습니다.
Thank you
코로나19에
very much.
대하여 인천 국제
He talked about special immigration procedures implemented at the Incheon International Airport. Thank you very much. He also talked about the close cooperation between Incheon Airport and Quarantine Office in order to ensure that the quarantine procedures are implemented thoroughly. Last but not the least, I'm going to invite Deputy Director Sun Tae-jung, and he will be talking about the quarantine measures for inbound travelers. Good afternoon. As introduced, my name is Sun Tae-jung, Deputy Director of Quarantine Management Division. So today I'd like to talk about the tightened but flexible immigration quarantine system of Korea and activities implemented together with the local communities. First and foremost, I'd like to express my special thanks to the Ministry of Foreign Affairs and Ministry of Justice who have hosted this event so that we can share our experience with others.
메르스 집단 감염으로 인해 180명
Back in
환자가 발생했습니다.
2015,
8명이 사망하였으며
the MERS epidemic left us with 186 patients and 38 deaths, with more than 16,000 people put under quarantine. These are the major statistics of that time.
사회에서의 병원 내 집단 감염이
Failure of the first case at the quarantine led to an outbreak of infection among those in a hospital.
132번 환자
And patient number 14 infected more than 80 people without knowing it. And patient number 132 was transported 600 kilometers in search of negative pressure room at the hospital, and there were new MERS cases up to 23 per day. The number of protective equipment used in health institution was more than 990,000, with about 1.5 million masks used. Such an experience in 2015 led the Korean government to reform its national epidemic control system.
한국은 전역 정보를 취급하고
So in order to efficiently process quarantine information and conduct assessment before taking measures, Korea revised the quarantine law. ICT technology was used in order to improve the quarantine information system, which I will touch upon later on. At the Incheon International Airport, the quarantine facilities with negative pressure room was installed, which can house 50 patients at once. And the research facilities of biosafety grade 3 with the capability of detecting pathogens was installed. For the sake of better communication with the public on infection prevention control, online media were effectively used to deliver messages, and the Korean Center for Disease Control Call Center educated travelers on what they should know when they travel abroad. Since the corona outbreak in China this year and its global spread, the Korean government has implemented a tighter and flexible quarantine system. All the arrivals from abroad are required to fill out and submit the health status questionnaire and go through a special immigration procedure, which means that they are allowed to enter Korea only after the health status is checked and self-diagnosis or self-evaluation app is installed. For those who have symptoms, they are required to get the test done at the quarantine station. Once tested positive, they are transported to the hospital or care center to get treatment under quarantine. Those who are tested negative, they are put in 14-day self-isolation. In case of Koreans and foreigners for long-term visa and foreigners for short-term stay, they are moved to designated care centers. And those without symptoms, they are put in 14-day self-isolation. In case of Koreans and foreigners for long-term travel, travelers from Europe and US get tested within 3 days of arrival, and the rest within 14 days. Depending on the outcome of the test, they are either sent to hospitals or put in self-isolation. As for the asymptomatic foreigners with the short-term visa, they are put in 14-day quarantine in care center. And travelers from Europe and USA get the test done in outdoor testing station at the airport, and others from the rest of the world get the test within 14 days of arrival. And those who are tested positive are moved to hospital or designated facilities for care. Of those asymptomatic foreigners and those on diplomatic missions or public service or with the exemption issued by the Korean missions abroad, then they get the test done at the outdoor testing station at the airport. And if they are tested negative, they are exempted from isolation. But still, they are required to comply with the active monitoring health check every day. Since January 19, when we had the first case from China, the number of imported cases stood more than 1,100 as of May 20. Of these, 503 were identified during immigration process, and they were put in quarantine and received the treatment. And the rest, 646, were confirmed in communities. This means that about 43 of the imported cases were identified at time of arrival, making contribution to the prevention of the spread of the virus in the communities. During the period above, for those people with symptoms, Korea has conducted about 20,000 tests on them.
코로나19 해외 유입 전체 확진 환자 중
Of all the imported cases of COVID-19, the US and Europe account for the largest proportion. Arrivals from Europe account for 39% and US 42%. And of all the imported cases, the Koreans were around 89%.
우리는 이게 코로나19 발생과
Taking into account the number of arrivals from abroad and imported cases, we have flexibly implemented different measures, such as designation of regions requiring quarantine inspection and implementation of special immigration procedures and testing. In January 2020, China produced more than 90% of COVID cases, so China was designated as a hotspot, requiring a quarantine inspection for those who come from it. Starting from February 4th, the special immigration procedure has been implemented on arrivals from them. And with the COVID-19 cases skyrocketed in March,
미국과 입국자에 대한
on March 15, the special immigration procedure started to apply to arrivals from major European countries. Later on, March 22nd, testing was done for all passengers coming from Europe. And from mid-March, when we saw the sharp increase in the COVID cases from the USA, that led us to put all the travelers coming from US in 14-day quarantine, starting from May 27th.
1만 명당 해외 유입 코로나19
Such a flexible implementation of different measures led us to have this kind of graph. As you see here, the number of imported cases per 10,000 arrivals declined drastically after reaching the peak in late March at 171. As for those cases from the USA, it peaked at 89 in early April, but started to decline from then. As of today, the number of positive cases per 10,000 arrivals stands at around 15 per week. Following WHO's declaration of COVID pandemic, Korea has applied a special immigration procedure to all arrivals starting from March 19th. Special immigration procedure refers to the process to confirm their address in Korea and contact information are correct or not. So all the passengers, they need to enter that information. We confirm that information at time of entry.
국내 체류 시 14일 동안 매일
And upon arrival, they have to download the self
등록하게 합니다.
health check application in their mobile phone and register their symptoms of fever, cough, if there is any, and every day for the following 14 days. If they report any symptoms during the period, it is notified to the app monitoring team who would contact the person right away and get the test done.
증상이 발현할
This app allowed us to detect those people who develop symptoms
검사와
right away so that they can get the test done and the treatment right away. And this helps us to prevent the spread of the virus within the communities.
2015년 한국에서의 메르스 발생 이후 입국
Since 2015, when MERS broke out in Korea, the Korean Center for Disease Control built and run a quarantine information system based on ICT in order to take swift actions to control epidemic originated from abroad by linking the quarantine activities at immigration office and the infection disease control in communities. Based on the information on the travelers on board. The quarantine information system manages the travelers by connecting its system with the passport information system, immigration information system of the Ministry of Justice, and health insurance system and roaming information system of the mobile carriers, so that accurate database is built and confirmed about the travelers on quarantine. Using the system, the Korean Center for Disease Control shares the information of travel history of the passengers with the healthcare facilities, and during the monitoring period, we can check whether anything was wrong. By doing so, we were able to minimize the spread of the COVID-19. Korea has responded to COVID in collaboration, engaging the Ministry of Health and Welfare, Ministry of Justice, Ministry of Foreign Affairs, and Ministry of Interior and Safety, and Korea Airport Corporation. Under the Framework Act on Management of Disasters and Safety, there are 27 types of social disaster crisis management standard manual and 10 natural disaster crisis management standard manual. Infectious disease disaster crisis standard manual is one of the manuals that belong to the first type. The Ministry of Health and Welfare writes this infectious disease disaster manual, and each central government ministry is required to prepare the practical manuals that can be implemented on site. Once Korea had the second largest number of COVID-19 cases in the world. Mass testing, contact tracing, and isolation of those infected, and minimization of the imported cases led us to be called a role model for COVID-19 management today. All this was possible due to the general public's active participation in social distancing and sacrifice made by the healthcare workers. I'd like to take this chance to express my special thanks to them, and this brings us to the end of my presentation. Thank you for listening.
의원님 수고하셨습니다.
Thank you very much. Deputy Director Son presented flexible operation of various quarantine measures such as designations of quarantine management area, special immigration procedures, diagnostic test, self-isolations, and quarantine information system connection to local communities' management of infectious disease from the immigration stage. Mr. Son also introduced the current status of cooperation among various ministries and agencies such as the Ministry of Justice, Foreign Affairs, and Airport Authority. We will now begin the Q&A session. We have received various questions. In the order of the presentation, we will address question by question. First question goes to Director Gu Bon-jun. Let me read the question. Director Gu, how can eye pre-checking system specifically block high-risk passengers? Could you please elaborate? Yes. Hello everyone, I am Director Gu Bon-jun. The eye pre-checking is a system to check foreigners before issuing a boarding pass at the departing airport. To those seeking to enter Korea, whether they are allowed to enter or not, whether they have valid visas or not, will be checked, and after verifying all the information, the boarding pass will be issued. Since 2017, all passengers bound to Korea are subject to eye pre-checking system. So when passengers arrive at departing hall, the airlines tries to gather the information and send the basic personal information such as the nationality, names, the date of birth of the passengers, and detailed flight information, and the Ministry of Justice analyzes them and returns whether the passenger is eligible to enter within 4 seconds. The Ministry of Justice utilized the eye pre-checking system during COVID-19. to automatically identify high-risk passengers with invalidated visas and notify airliners to ban them from boarding any flight to Korea.
네, 감사합니다. 다음은
Thank you so much. The next question is to Director Kim. You said that visa information is provided to the local government in charge of infection control. Isn't there any concern over the violation of privacy? Thank you for asking the question. As for this, I'm going to talk about the law or act that we rely on. The personal information provided to the local government is the data processed in line with the regulations, which means that it is temporarily made available for the purpose of ensuring the safety of the general public. So it's in line with the Article 58 of the Personal Information Protection Law. So in order to protect the information, we we encode it, and at the same time, all the authorities do not disclose it to the third parties. This is my answer to the question. Thank you.
개인정보 보호 관련해서
For the personal information protection, there is another question to
검역정보 시스템
Director Son.
개인정보를
Using that information, personal information, the information is provided to the healthcare agencies or hospitals. Do you think that there is any concern over it? Thank you for asking a very good question. We need to find a balance between the protection of the personal right or information and the securing the safety of the communities. In Korea, we protect the personal information very tightly. However, in 2015, since the MERS outbreak, there was a general consensus made among Koreans to use the personal information for the purpose of the general public. For the purpose of preventing the infectious disease. So there are clear laws and regulations concerning that matter.
Next question goes directly to Lee Ki-hum. Here's the question. Proxy immigration will be carried out by receiving passports from travelers with the symptoms. What are countermeasures if and when a high-risk person attempts to enter the country? Thank you for your question. Let me answer. In the case of severely ill passengers with symptoms, a proxy immigration procedures will be carried out because the severely ill passengers have the risk of spreading the virus. So we get passport from these passengers, and there's no face-to-face immigration. So you might wonder or you might concern that the immigration process is too simplified. And in case of foreigner, we usually scan fingerprints and also we take photograph, but the proxy immigration omits all of these process. Still, we store and save the photograph, and using the photograph of the passengers, we'll once again search if they are a risky person or dangerous person or anything. And using our detecting machines, we not only check with our own eyes, but also we check using our technology whether they are high-risk people or not. Luckily, there were not a single case ever since such a high-risk person entered to Korea. Thank you for your answer.
시간 상황을 보아가면서 질의응답
We will address the question looking at time.
발표자에게 두 번째
And here comes the second question to each speaker. First, Director Gu Bon-jun. Here comes the second question.
부과장님,
Director Gu, after COVID-19,
와 관련된 제도에
what changes took place in tourism area? Can you elaborate? Well, that's a very tough question. First of all, in relations with the tourism, many changes take place. As I have explained before, the immigration policy is the area of my responsibility. So let me tell you what changes will actually occur post-COVID-19. During my presentation, I briefly mentioned that ETA, or Electronic Travel Permit System, will be implemented in Korea, and that ETA will take effect next year. ETA is a system that allows entry of visa-free foreigners by pre-collecting and analyzing questions required for immigration in a non-face-to-face online manner at the stage of travel preparations. With introductions of ETA, foreign tourists may feel somewhat cumbersome or uncomfortable with the process of submitting information in advance, but foreign tourists who have been approved via ETA in advances will get incentive, which means if you are approved, then you don't have to submit arrival card and you can immigrate using an exclusive immigration booth. So promptly, you will complete the immigration process. Also, we plan to utilize ETA application to provide tourism information available to foreign tourists. So using ETA, we will send out all the information so that tourists will enjoy a greater benefits and also heighten the quality of their travel. Thank you.
다음으로 김용훈
Next question is to Mr. Kim.
단기 비자로
Is there any restriction applied to those who enter Korea on a short-term visa? Do they have to bring the certificate to show that they are COVID-19 negative?
예, 좋은 질문.
Thank you for asking a very good question. As of today, when the foreigners apply for short-term visa at the Korean diplomatic missions abroad, they are required to submit a medical certificate which is issued within 48 hours from the date of making application. It is issued by a health institution. This practice was put in place on April 13th. Such medical certificate should contain information on the symptoms related to COVID-19, such as fever, cough, chills, headache, muscle ache, and pneumonia, whether they have any of them or not. It does not mean that they have to bring such a medical certificate when they enter Korea. Upon entering Korea, they should put themselves in self-isolation when they have the short-term visa. So those foreigners with the short-term visa, they have to be in self-isolation for 14 days. Thank you.
네, 김서무관님 답변.
Thank you for answering the question.
이기엄 국장님에게
Next, Director Lee Gi-hum, here comes your question.
코로나19 대응
Responding COVID-19, foreigners are eligible for penalty when they refuse to comply with the self-isolation. Could you specify what are the penalties? We notify that they are subject for self-isolation or quarantine, and if they refuse to comply, then they are deported. So, the special quarantine procedure, we already notified through Korean diplomatic missions abroad and to airlines throughout the world. So they know before they arrive. As a way to ensure the quarantine during the immigration, foreigners are issued restrict order on the scope of activities and also their responsibility to comply with the quarantine or self-isolations at government facilities. And upon receiving this notice, we receive receipt from the foreigners because we want to verify that they have actually been well notified. But when they undergo self-isolation, sometimes some of the foreigners refuse to comply with the self-quarantine, but we tell them that they are denied from entering into Korea. Most of the time, they comply with the quarantine process. So basically, we deport them and their entry is prohibited, but very rarely that actually happens. Thank you.
다음으로
Thank you. The next question goes to Mr. Sun.
드리겠습니다. 연구관님,
Mr. Son,
미국발 입국자에 대해서는
as for
지금 3일 내에
the
진단 검사를
arrivals from Europe and the USA,
대해서는
they had to take the test within 3 days. For the rest of them, they are required to get the test within 14 days. Can you tell me the reason? As for the imported cases, 81% are from Europe and the USA. And out of all the inbound travelers or inbound people, those who are from Europe and the USA account for 35 to 45%. So when we rate the risks by continent and by region or nation, we realize that based on the number of or proportion of the imported cases, we believe that arrivals from Europe and the USA belong to the highest risk group. That's why they are required to get the test within 3 days of the arrival, but for the rest of them, they need to get it within 14 days.
네, 연구관님 답변.
Thank you.
이제 마지막 질문이
This will be the last question.
구본준 과장님에게 다시
Once again, this question goes to Director Gu Bonjun. Director Gu,
한국 정부는 해외로
in order to block the spread of COVID virus to overseas, Korean government prohibited the departure of high-risk personnel. How did you do it? How did you block their departure? Can you elaborate? Well, thank you for your question.
먼저 출국 금지 제도
First of all,
아마 세계 모든 나라들이
prohibitions of the departure, I believe, is not a system widely implemented. Korea is one of few countries that implements this. When a criminal commits crime or when a person tries to take their financial asset to abroad, then we operate the prohibitions of the departure. However, now is a time where the spread of COVID virus is rampant. That is why we are applying these departure prohibitions. In order to prevent COVID-19 from spreading overseas, the Ministry of Justice, at the request of the Korea Center for Disease Control and Prevention, prohibit the departure of Korean nationals and foreigners who are in self-isolation as they were confirmed cases or who were in contact with confirmed cases. When departure is prohibited, the boarding pass cannot be issued through eye pre-checking system during the self-isolation period, and as soon as the self-isolation period is over, departure prohibition is lifted.
앞서 설명드린 IPC
I have explained to you the eye pre-checking system, and eye pre-checking system can be used not only for foreigners coming into Korea, but also for Korean nationals going abroad.
요청할 수 있는
The grounds for requesting departure prohibitions are stipulated in the quarantine law if it's related with infectious disease and the Immigration Control Act, and also there's a Subordinate Act and Immigration Control Act. Thank you.
이상 답변 마치겠습니다.
네, 과장님 답변 감사합니다.
Thank you very much.
다음으로 우리 김영우
Next
장관에게 또 질문
question is to
장관님. 한국의
Deputy Director Kim.
200만이 넘는다고
You said that the number of foreigners living in Korea is about 2 million. In terms of the efforts made to curb the spread of COVID-19 virus, such as the social distancing, what measures have you taken for them?
예, 질문
Thank you for the question.
법무부는
As for the Ministry of Justice, in order to implement the social distancing,
장하는 조치
we allow the extension of the duration of the stay of the foreigners. As for the foreigners living in Korea,
출국 외국인
they tend to visit the immigration office to apply for the extension of their stay
네, 그런 과정에서
or have other requests processed. This means that they may use the public transportation or other public facilities along the way, exposing themselves to infection or may infect others if they are carriers. So we have taken measures in order to minimize their movement and expand the window through which they can file their request or complaint. So in details, we extended the duration of the stay for those people whose visa would expire shortly.
본국으로
And such extension was granted twice in total up to now.
기간 연장을
And then they can make application online, which is in place as of today. And for those foreigners who are studying in Korea, they do not need to make application themselves because the schools they belong to are permitted to make a group application for visa extension. And as for the Minister of Justice, we will take any other measures if necessary. Thank you.
감사합니다. 다음은 손태종 연구관님에게
I have one more question to
연구관님. 입국
Deputy Director Son.
상자만 진단 검사를 하는
At time of entry, do you
증상의 이후 증상들을
have the
진단
test done
검사하는
for those people with symptoms only? If so, what kind of symptoms require testing? At time of entry, we check fever or respiratory symptoms mainly. And as for those people with those symptoms, they have to get the test in the quarantine booth right away. But as for those people without symptoms, even though they do not have symptoms, if we have any suspicion that they might have come in contact with the infected people, then we may request them to get the test done. So, we are taking very active measures in order to make sure that the test is done whenever it's necessary. And thanks to the efforts that we have made, the 33% of the imported cases were confirmed at time of entry. By doing so, we have contributed to the further spread of disease in the communities.
감사합니다. 우리 패널 분들에게 한 세 가지씩
Well, I have posed
드리고
about 3 questions per panelist or speaker.
오늘 현장에서 추가적으로
And
몇 가지 질문이 더 들어왔습니다.
We have received a couple of questions. Regarding these questions,
답변을 위해서
we would like to give more faithful and thorough answers. So instead of giving you the answers right now, we would like to understand the questions and send you reply via email, or we'll post answers on our website.
어떤 질문이 들어왔는지 잠깐 소개.
Let me briefly introduce you what kind of questions we have received. First of all,
한국 입국에
Korean government is applying stricter rules to enter into Korea, and also that Korea has updated versions of which countries can allow to enter Korea or not. And second question, regarding the patients who have symptoms, and if they violate the regulation, do you have a certain system to monitor them? Third question, diplomats and also the family members of the foreigners and also the students studying in Korea, what are the visa system that you are applying as a way to respond COVID-19? Any additional restrictions or any additional special measures are to be taken in the future? Fourth question, regarding illegal immigrants or foreigners, we heard that Korea provides free test for COVID-19. How effective was it? As I have answered to you before, as soon as possible, we will post answers as faithfully as possible on our website. It is time to wrap up. Today's webinar was held for the purpose of sharing Korea's response to COVID-19 in the sector of immigration and quarantine with participants from abroad. Korea's response to COVID-19 is an ongoing progress. There are still many challenges to be tackled, while new challenges may rise again in the future. However, based on the right principles, we believe that solutions can be found through collaborations and solidarity that transcend our fields and boundaries. I sincerely hope that today's webinar will serve as a reference for responding to infectious disease in other countries. May all the other countries in the world wisely overcome COVID-19 and regain their health.
이번 사태로 인하여
COVID-19 unfolded unprecedented situations such as shutting the borders, lockdowns, stopping airline operations, thus shrinking the exchange of personnel. Let us work together. Let us overcome COVID-19 and facilitate exchange of people in the future. I sincerely hope that can happen. When that happens,
만나고 있는 여러분들을
I very much wish to meet you all offline, not online, and let us all have a great time together. That's my dearest aspiration. Thank you once again, all the participants of the webinar. Stay healthy.
listening everybody.